Hello, I'm Damian Blum, and I want to show you a little questionnaire that is going to assess the risk for obstructive sleep apnea, or OSA. It's called the STOPBANG questionnaire. S stands for snoring, T stands for tired, O is for observed, P stands for pressure. B, that stands for BMI. A will stand for age, N for neck size, and G for gender. So let me go through these steps. The first one, the S. Do you snore? Do you snore loudly? It is known that over 40% of adults over the age of 40 snore. And we know that 70% of the time, loud snoring is an indication of sleep disorder breathing, the most common of which is obstructive sleep apnea. The T is for tired. Do you wake up excessively tired? Have you been sleeping all night and you're open, your eyes are open and you're refreshed? Or do you need to have an IV infusion of coffee? Are you tired in the morning? Are you tired during the day? So if that's a yes, that's a problem. O is for observed. Has your bed partner observed you during the night, gasping or choking or stopping breathing? That's very important. And P is, do you have a high blood pressure? Because we know that if you have obstructive sleep apnea, you will develop high blood pressure. The B, BMI. Is your BMI 35 or higher? Anything over 30, we're concerned, but we're looking at 35 here. A is for age. Are you 50 years old? We know that as we age, the muscle tone and fat distribution changes, and that will settle in the neck and constrict the airway. N is for neck size. If you are a male with neck size 17 inches or higher, or a female with neck size 16 inches or higher, you're at risk. And G is gender. We know that males are at least 2 to 1 as far as having a risk for obstructive sleep apnea as we get older. When we're younger, in the 20s and 30s, males have an 8 to 1 ratio of possibly having obstructive sleep apnea. So you had 8 questions. It's either yes or no. If you scored yes in 5 out of 8, that means that you're at high risk for having obstructive sleep apnea. If you scored 3 or 4, you're at a medium or moderate risk for apnea, and 0 to 2, you're at a low risk for apnea. I hope that helped you.